Hey Green Bay, Deanna here, and I'm one of the owners of Burn Boot Camp, and I am here with Bob from ProMotion Physical Therapy right in downtown De Pere, and we're going to talk to you a little bit about pain and exercise and maybe how to keep your body moving through some injuries. So I will let Bob take it away. Tell me a little bit about yourself, a little bit about your practice. What do we need to know about you?
All right. So yes, I am a physical therapist, and my clinic focuses on keeping people healthy, moving despite pain or injury, help them recover from pain and injury, and my goal with everybody is to just try to get them back to being able to be active.
That's awesome. That's awesome. To transition a little bit about that, taking that into our practice here. So something that we commonly see in the gym is, ouch, I have an injury, I need to be done. Kind of the idea that once we hurt ourselves, we need to do the RICE method, rest, ice, elevate, and I'm missing one of the other, compression, yeah. But I think that we're trending a little bit away from that, so I would love to know your perspective on the importance of movement throughout injury and what you would recommend for that.
Yeah, I see the same thing in my practice. A lot of people who are regular exercisers start to have a pain episode, and whether or not it was from the exercise or not, one of the first things they do is think, oh, I got to stop exercising, right? I need to rest this thing. And before you know it, it's a week later, 2 weeks later, a month later, and they've gotten away from the things that keep them healthy, right? So there's two problems with that. Number one, in order to stay healthy, consistency is the key, right? Just staying on track with your programs, whatever your workouts are. And then number two, in a lot of these painful conditions, staying active and moving is one of the best things you can do for recovery. We'll talk about back pain a little bit later, but first line treatment for back pain is to stay active, keep moving with some modifications. All right, so we really want to try to focus on keeping you doing the things that you enjoy and the things that keep you healthy, but do it in a way that respects your pain, but still allows you to work around it. All right, so what do I mean by that? So we want to try to modify things a little bit. So if you're having a painful shoulder or a painful knee, the things that we focus on is let's keep moving that joint, let's keep working those muscles around that joint, but let's make some changes that keep it a little less painful, right? So the guidelines that I normally give my people is if you're exercising or you're doing an activity and your shoulder hurts, say, like a 3 out of 10 or a 4 out of 10, I always tell people to work through that. That's okay. What we don't want to work through is like pain levels of 6 or 8 or 9 or 10 out of 10. We want to keep it mild, so a little bit of pain is okay to work through. So keep that in mind. And then the other thing is, how do you feel 24 hours later? That's a really important gauge to know whether or not you did too much or whether what you're doing is okay. So a true 24 hours later, is your painful area any worse than what it was before you worked out? And if it's better or no worse, that's a green light to keep going, right? If it's worse, then that might be something where, okay, I want to keep moving, but I need to back off a little bit. So we can use that as a guide. Now the other thing is, sometimes you'll be doing an exercise and you're like, holy cow, this is like 7 out of 8. And then we want to look at what are the modifications that you can make to keep exercising. And when we talk about modifications when we're exercising, there's 3 things that we can consider. One, we can decrease the load of the exercise. So if you're doing an overhead press and you normally do it with 20 pounds, hey, let's try 10 pounds, right? If you do squats or step-ups with weight, can you do lighter weight, right? So decrease the load is number one. So try that. See if that can get that pain level down a little bit lower. Number 2, we can adjust the range of motion of a movement. So if you're doing a step-up or a squat, can you go a little bit shallower in your squat? Like change the range of motion. Can you use a shorter step to do your exercise, right? So that would be adjusting the range of motion. If you're doing a lunge and you normally go down to where your back knee hits the ground, but now your knee hurts, so maybe go down halfway, but still do the lunge, right? So there's ways to work around that by adjusting the range of motion. Shoulder, I want to give a shoulder example. So if you're doing a shoulder overhead press and it hurts, right? So many times with overhead press, it might not be the top part that hurts. It might be when you get down here and do that first push. If you're doing a push-up, it might be at the bottom position that your shoulder hurts. And if you stay above that, you could do a half push-up. So that's what I mean when we talk about adjusting the range of motion, all right? The third way we can do it is, for some instances, we can adjust the angle of the joint in the exercise. So going back to the shoulder, if you normally do your shoulder presses with your elbows out and that hurts, try changing the angle to where your shoulder's out at like a 45-degree angle or even out in front of you, and see if changing the angle of that can help. For squatting or knee pain, see if moving your knees out helps with the squat or moving your knees in. Okay, so that's what we talk about in range of motion. So to work around pain, there's lots of different options. Decrease the load, change the range of motion, or change the angle of movement. And many times you can keep exercising and make those modifications. You can keep doing, if you have a shoulder problem, you can keep doing your lower body work. You can keep doing your core. Many pulling exercises are going to be pain-free, but your pushing exercises or over shoulder motions, those may be the ones that you have to adjust.
Yeah, that's great. I mean, I'm always a proponent for movement and staying consistent. It's very easy to lose your consistency, and if you can work through those things, then absolutely movement is going to be the best thing.
Yep.
I wanted to touch a little bit on kind of our other onset, or our other our other notion that rest is always best. What are the consequences of staying still through an injury, or pausing your membership, or pausing your routine to take some time off?
Yeah, I think over the years, one of the biggest things that I've learned about helping people with pain or injury is that your health has a huge influence on your recovery, right? So, for instance, if you injure your back and you just sit around and do nothing, that's going to influence how fast you recover. You want to keep moving within the tolerance of what your back allows at the time. The other thing is, if you're taking a month off from working out to wait for your shoulder to heal or your elbow to heal or whatever, there's no doubt you're getting less healthy over the course of that 4 weeks, right? And again, there's lots of research that shows your overall health is going to have an influence on how fast you recover. So the biggest thing is to keep exercising around the pain. Do what you can to stay healthy with some modifications, and just keep persevering through it.
Okay, great. Is there ever a time where you would recommend rest?
Yeah, I think sometimes it's smart, like in an acute injury. Now here's let's say we're doing box jumps or something, right? And I step down and I feel a sharp pain in my Achilles, and now I can't walk without a limp. I can't rise up and down on my toes. You know what? That's a specific injury that maybe needs a few days rest to it, right? But what we see is there's a lot of pain that just gradually comes on, or you wake up with it for no apparent reason. You didn't really injure anything. This pain just came on, and this is really prevalent in back pain, right? So the key there is that there's no injury that you need to wait to heal. The best thing you can do is get moving early within what you will allow, and then it will gradually progress from there.
Awesome.
So I would say acute injuries where there is a specific incident might need a few days rest and recovery. But again, more and more research with muscle and tendon is that early active movement helps you recover faster.
Okay, that makes a lot of sense. I have one more question for you. Why is this happening? Why are people getting pain? What are some of the common things you're seeing from some of your clients that you would recommend some advice to some of our members as well? Yeah.
Yes. Yeah. So I think when we talk about pain onsets, right? Everybody realizes that, you know what, if I do something stupid, I may injure myself. So there definitely are times where there's a physical reason for the pain, and by physical reason or the reason this occurs is doing too much, too fast, too soon, right? So coming into a gym setting, you're new and your buddy there is doing this and you want to keep up, right? Being competitive with others will cause you to push too much, right? So the biggest thing is to don't make big jumps, don't push yourself too hard, too fast, too soon. Let your body adjust. It will get used to anything that you want. I always tell people there's no exercise, there's no activity that's off limit except the ones you're not prepared for, right? And we get prepared for those by being consistent in doing them, okay? So that covers kind of the physical components of it. But the other thing that we have to think about is stress is stress to our body. So it doesn't know the difference between physical stress, like I worked out really hard, and psychological or emotional stress. So research has consistently shown that not sleeping well is a risk factor for injury. They've done this in high school and college athletics, right? Being under excessive stress can predispose you to an injury risk. So, you know what, if your life at home is crazy, you're under a lot of work stress, you're not sleeping well, you know what, you might need to just monitor your body and realize that, hey, you know what, I'm feeling kind of run down and stressed out right now. I want to do this workout. Maybe that's not the time to go all out or, you know, set a personal best on your workouts, right? I think the other thing that consistently shows is that our diet definitely has an influence on pain onsets. So, you know, consistently eating well is going to help. So there's things outside of just physical that can definitely contribute to pain onsets. And you really got to listen to your body and what's going on in your entire life, sleep, stress, nutrition, and kind of understand that those sometimes can have an influence on what you feel and minimizing the risk of a pain onset.
Yeah, absolutely. And we don't expect you to change all of those different pillars of health
That's
at
right.
one time. That's what we are here for. That is what Bob is here for, to help us get more and more healthy every single day. So I'll have more information about Bob and his practice if you're looking for some help, if you have kind of a nagging injury, and he can help you take care of that. But thanks, Green Bay. As always, I'll take you up with 2 claps on 2. 1, 2.